Hello, everyone. Welcome back to Real Talks One podcast. Today's discussion would be our live experience of childbirth and primarily aftermath of that. I had actually shared a podcast on our experience having two children, one in India, one in the US. Did a comparison of that about a month back. Now that her child and both mother have already passed initial 40 days of childbirth. I like to recount some of the episodes that has happened with us here in the US. So this becomes a ready reckoner for anyone here who is going through pregnancy and anyone who is thinking of expecting basically a childbirth here in the US. Again, my experience is not across the US, but this is specific to my case. However, I have heard similar things from other people too, and I would like to narrate it from the very starting so that all the people out here can benefit from this and take due course of action. So, in a long story short, I would like to give the initial summary that we are extremely unhappy with the way the hospital managed overall delivery, especially the outpatient treatment has been horrible. And initially we were hoping that things would like automatically work fine because we had an experience of an earlier delivery in India which went extremely smoothly. My wife was up and running on the sixth day even though it was a C-section. Here in the US things turned out to be extremely difficult for us for the last 1 month plus, and only now we are kind of experiencing and understanding how grave mismanaged the entire process has been, and we'd like to suggest some of the things that teams here can do to make a difference to people that are going through pregnancy and childbirth and things along those lines here in the US. So let me narrate the summary of events that happened. So we were seeing Evergreen Hospital. We got assigned a doctor that saw us throughout the 9 months. So that was uneventful. We used to go on time, show the development of baby, get all the tests done, and things were moving fine. And when we came closer to the delivery date, we wanted to see where the process would happen, etc. So hospital has scheduled like an online kind of a visit of the hospital. There was no physical visit of the hospital possible. So we had done that as well, and we were very familiar with where is the maternity ward, where the deliveries, etc., would happen most likely within the maternity ward. Doctor specifically informed us that you can just go to the maternity ward and they'll take care of you. In case if you go in non-working times, which is considered as an emergency, just go to the emergency ward. That's all the doctor said to us. So essentially, what happened when we were near to the delivery date, in the night around like 12 a.m., wife experienced a lot of pain, and we rushed to the hospital directly to the emergency ward. So when we reached to the emergency ward, the staff member out there told us that, oh, we don't take care of the maternity people. You should go to the maternity ward. So we said, okay, fine. So then we basically drove back to the maternity ward. But having reached maternity ward, we found nobody there. In fact, the whole hospital was locked. So we were very shocked that an emergency staff member would send us to a different place where basically we'll find nobody. So having reached there, I actually again went back to the emergency ward and stated to them that there is nobody out there. Like, how am I supposed to enter when the whole hospital is locked? So to that, the emergency staff member said that call the security staff. They should be able to help you. When I tried to knock the door of security staff, nobody opened the door. When I saw inside, there was nobody sitting in the security staff basically. So, I mean, this back and forth kept on happening. I kept on going to maternity ward, then I came back to emergency, back and forth couple of times, and I basically got fed up because my wife was in severe pain at that point of time. So finally, I called 911 in right in front of the maternity ward, and they asked me like, "Where are you?" I said, "I'm right outside the Evergreen Hospital." In front of the maternity ward, but it is locked. There is nobody out there. I can't access it and go inside, and the emergency room is not taking us. So the 911 said that we can't do anything, but we'll try to call the hospital and see somebody comes out to open up the door and take you in. So we waited there for another 10 minutes. There was nobody out there. Even the 911 never called us back. So we knew that we had to do something drastic. So I again this time went back to the emergency ward. I started shouting on the staff members out there to take my wife immediately because she was in immense pain. So finally they caved in and she assigned a nurse to us, and nurse said, "Okay, I'll walk you to the your right place from within the hospital." And we started walking along with her. They didn't have any stretcher, they didn't have any bed or anything, that because my wife couldn't walk at that time, she was in extreme labor and pain. But finally I managed to get a wheelchair, had my wife sat on it, and I was like pushing her all along in at like around 12:30 1 a.m. On that night. So while we were going through there, what we figured out that the nurse who is basically part of the emergency ward itself did not know about the whereabouts of the hospital itself. So she took us to some like a wrong place, and there she started inquiring like where is the maternity ward, etc. And then they said, "Oh, you have come on the wrong floor. You have to go to this." So she gave her the directions, and then finally she basically landed us in a right place. All throughout this ordeal, we were like extremely frustrated by now. We had lost precious like 40-45 minutes by then, but finally we landed into the triage nurse who is part of the maternity wall, and she seemed to be very perturbed, like she seemed to be very surprised, thinking that why didn't you come through the maternity ward? I said there was nobody out there. We were outside here multiple times, but there was no one there to open up the door or take us in. She said, well, there was a doorbell, you should have rang that. Like, who on the right mind would think a hospital will have a doorbell that you can ring and this way you can come inside? It's not like a house, it's like a damn big hospital. And nobody told us there is a doorbell on the specific door on the like hospital, because even the maternity ward has multiple doors through which you can enter it. There is only one door, specific door, that has a bell. That's what they told us at that point of time. So first thing is, our doctor who we saw for 9 months never told about this procedure to us. We knew where the maternity ward was, we knew where the emergency ward was, but doctor never told us about the doorbell, and that you have to press this doorbell on this specific door, and then somebody from the inside will take you in. But finally, that episode happened to be a false positive, because that was not the D-day. Essentially she was experiencing pains, etc., but doctors provided her on-call doctor provided her with some IV fluid, and after 2-3 hours she was kind of fine, and they said, this is not your labor pain, but if something comes up, do come now. So in one sense this was a blessing in disguise, because had it been the D-day it would have been very catastrophic for us. But because it was a false positive, she was not delivering that day. We were sent back home, so we went back home, and we now knew what needed to be done. Just in another next 2 days, again in the night, around the same time, 12 or 1 a.m., we landed back to the hospital, this time directly to the maternity ward. Now we knew where the bell was. We rang the bell, and in 10 to 15 minutes, we were basically taken in the hospital. And they started the process of like discussing things and things like that. So, second time we had a much better experience, so we were in a good mood, and they took us in. uh, After throughout the whole day, like 24 hour passed when she became closer to the delivery time. But throughout the process, right, she was only being taken care of by the on-call doctors. Her doctor who she visited for the last 9 months never even cared to show up or visit her even once. I can understand in the night the doctor might not have been there, but even in 24 hours, you would have got notice that your patient is in labor. At least they could have discussed with the other doctor who was basically delivering her. Maybe they would have come up in the morning to see her or check her upon her. None of it happened actually. The main doctor whom we visited for the whole 9 months didn't had any role to play in the actual delivery process. So that's something we thought about it, but then didn't care much at that time, because for us to get the delivery done was main important. So during the delivery, another doctor changed. This time there was a third doctor who came in, who started helping out with the delivery. What we found out in this process was that the nurses out there, they seem to be lacking quite a bit of knowledge. So while my wife was in labor pain for almost 4 hours, little over 4 hours actually. So in 2 hours itself, baby had come all the way down, and baby was stuck. So when the doctor visited, she said like, let's try a little bit more. But doctor became busy in some other delivery, so she was not no longer available for another 2 hours. Meanwhile, the nurses, rather than informing this critical piece of information to the doctor, kept on asking my wife to push, push, push. So the baby was in the same stuck position for next 2 hours without moving even a single centimeter or an inch. And when doctor finally got free, she came back. She said, "Oh, this was probably this didn't even move even like a single centimeter in the last 2 hours." So this is like we need to now do a vacuum extraction for the baby. That's when they started doing it. They could have done the same thing like 2 hours ago, so the labor pain could have been reduced, and at least my wife would have had more energy and would have less pain from this process. So finally the doctor came in, they did a vacuum extraction, and they did it in such a way that the baby had actually very big swelling on the head. It almost seemed like pharaoh's head, like the head, it goes elongated like something like this, like somebody has worn a cap or something like that. It almost seemed like it. And in fact, during this process, there was a big like a scar on the scalp. Actually, it basically got cut 2.5 centimeters, uh, and both of these things were there. And doctor said this is probably normal, it will be okay. It sometimes happens when you do the vacuum extraction. Meanwhile, doctors, when they were extracting out the cord, they basically dropped the cord and the cord blood was completely lost. That's another thing that they did during the pregnancy. On top of it, after the pregnancy happened, we were still kind of fine because we were happy that finally we had the baby, and everything seemed to be kind of okay. Then they shifted us to a separate room, post delivery room. In the post delivery room, our experience was completely different. While during the delivery and prior to delivery, there was a dedicated nurse given to us who was like super kind, super helpful, etc. But post delivery, when she was shifted into a different room, there was hardly any kind of nursing given. If you call the nurse, they would show up only after 1 or 2 hours, and that was a lackluster way things were. But we were still okay, okay, fine, baby has been delivered and things like that. Finally, I had already filled all the paperwork that is required, and I tried to ask the nurse that, hey, I have some questions around this, some names and all we need to write. And the nurses just shunned us at that point of time. Don't worry about it, we'll look at it at a later point of time. And actually nobody did look at it at a later point of time. They just took the paperwork as it is, and we also forgot to ask that questions. Then we basically moved back home, and while we were going back home, we had to bring in a baby back to the hospital to check up for any kind of jaundice and all. And uh, two times we went back to the hospital, and there they measured the jaundice for the baby, and they found out that the jaundice is basically going down. And they said that the baby is now kind of healthy, and he'll gain weight. So that specific pediatric doctor was really good. She seemed to be very caring. She saw us, like, immediately gave us immediate urgent appointments, and that was good. And then we went back. Uh, After about a week or so, my wife started, getting a lot of chills and like very high fevers of 104. So we immediately called back the hospital that, hey, this is happening, what we should be doing. They kept on prescribing just take Tylenol and ibuprofen and things like that. So we kept on doing that, and till the time we used to take the Brufen and all, the fever seemed to have come down. But moment you remove it, it again went back. So we knew something is wrong. So this kept on going for back and forth for about a week time, and we were not able to get hold of the actual doctor. So finally, in one of the evenings, we were able to call the hospital, and they connected to on-call doctor. And this time, this on-call doctor was the doctor we saw for the whole of 9 months. This was the first time in the entire process post delivery we were able to catch hold of our main doctor. So after hearing the symptoms and all, he said, "Hey, this looks like UTI. You should go for test for it." And lo and behold, we tested and we found it was actually a UTI. So then we went to like an urgent care for getting this testing. They prescribed some antibiotics, a course of 5 days. My wife went through it. The moment she took antibiotics, she no longer had chills or fever and things like that. And in 5 days, the course was over. And then we asked actually the nurse that like, should we test it again to see if it is there or not. He said, no, don't worry, it's fine, your course is over. For 3 days we kept on doing this back and forth. Meanwhile, my wife started getting the fevers and the chills again. And after pushing them very hard that no, we need to test it again, finally we tested it again, and this time again there was a UTI actually still there. So then they asked us a course to, again they repeated the course again, this time around, and this one was for 7 days. So we went through those 7 days. Again, she was not having any chills and fever while she was taking antibiotics. But you can understand, she lost 3 days in between. She could have gone through the same like medication even in those 3 days, and so that she could have avoided these kind of things. But that's not how the system in the US is. It's like too much back and forth, and every time you talk, either a nurse will come who will not understand the whole situation, and she will keep telling you to just take Tylenol and ibuprofen, and this is as in pregnancy, these are the common things, these are the common things, rather than focusing on the problem and solving for it. Unfortunate part is that you don't talk to your real doctor who has seen you for the 9 months, who has the entire history and who knows the thing. Every time you talk, there is some other doctor that comes, they will give you some other course of action. But the good part is, even if as long as they're a doctor, they will have some better knowledge and information than a nurse who kind of just keeps you by default, just take some ibuprofen and Tylenol. So finally, after 7 days treatment, while the UTI, have possibly might have subsided, but my wife was still having fevers, low grade fever around 99 and 100, while earlier it used to be 104, and some basic chills she was still getting now. So again we tried to contact this hospital and all, and again they were not listening. They asked us to check for UTI again. We went for a UTI again. This time we went to like a urgent care, because nobody was listening over the phone, so we went there. Again they conducted certain tests, and she gave us the antibiotics for UTI as well. And she said that, uh, if your test comes negative for UTI, she will then give us a different course of medication. And my wife also contracted some like sour throat, etc. So she will give her an antibiotic that will cover for both those things, right? So after looking at the doctor, we got the antibiotics and took actually 1 dose, 2 doses of antibiotics till the test came, and the test came negative for the UTI actually, and only it had throat infection. So we tried to reach out to the doctors again, hey, do we need to change our course, because now we do no longer have UTI, so why we should be taking the medication? There was no zero response from the doctor. So we took a conscious call, tried to call the nurses and all, not in the urgent care but the main hospital. Nurse said, oh, it is your choice, if you have symptoms take it, if you don't, you don't take it. It's such a callous way of looking at things, because now it tells categorically through the urine culture that there is no UTI. So if there is no UTI, there is no point of having symptoms or not symptoms and taking the antibiotics or not. It should not be taken, because antibiotics is specifically supposed to be taken only when you have a specific infection. So we did not take it, but she was still having low grade fevers and things like that. And the nurse said, yes, just keep taking like some basic medicine. Meanwhile, our 6 weeks visit came along, and she said, why don't you ask the doctor when you visit here? That would be the appropriate time to discuss this. So we went there this time for a 6 week visit. Again, our main doctor who we saw, and this is a scheduled visit, this is not even an emergency visit in day. Again, our doctor was not there. This time around there was a fourth doctor who we were seeing for the same delivery and case. um, so this doctor also just kept on asking questions to fill her check boxes and all, but she was completely unhelpful and kept on saying, "Oh, so how well you are doing? How well you're doing?" And we said, "No, we are not doing well. We have been under tremendous pain, pressure with fevers and chills. We are not able to take care of the baby and things like that. And something is definitely going on. So we need to check again." She ordered a UTI test again, even though the UTI test previously had come negative, and we had taken another UTI test which had also come negative because we went to urgent care. This was a third UTI test. Maybe we should do pap smear as well. Maybe we should do some test for ultrasound to see if there is anything left in the uterus or things like that. She said, "Yeah, I'm sure I can order those things, but I don't think so. Any of those things will matter, because your fever and all are not consistent with vaginal infections and things like that." So anyway, we got those tests done, and we were fed up with this Evergreen Hospital, with how they were delivering care and how they were not taking any ownership. I was super, frustrated looking at this doctor's attitude, because she kept on saying, "What antibiotics did you take?" Even though that was there right in front of her in my charts, because here everything is integrated. Whatever prescription is given to you, when did you see the doctor, what test results, etc. It's all there in my charts. So it was, my chart was right open in front of her. All the symptoms and everything that we have gone through was right in front of her. Still, she was saying, "I guess what is the antibiotics you have taken." So I had to personally call her out and say, "There is no point of guessing in this point of time. This is critical for us. Look at your screen; it is right there." I am not a doctor to know the exact name of the formula or medication, but she, as a doctor, can see, read it, and I can also read it if I had access to that screen at that point of time. So even then, she never read it and all, kept on just giving, "Oh, my guess is this, my guess is that, this doesn't look like the case, this looks like the case, etc." All kind of nonsense she told it there. So by that time, we had already given up that, not our main doctor who we saw for 9 months doesn't care about this delivery at all. Neither he was present on the delivery, neither he came to check in on us, neither he is available for the 6 week scan, etc. In fact, this was pre-scheduled 6 week scan, and they cancelled at the last moment, saying that the doctor is no longer going to be available. Like, who does that actually? At least once that doctor who we saw for 9 months should have come to visit us, right? Just to understand like how the mother was doing or the baby was doing. It seems it was just all transactional all along. Like, there was no bond built over the period of last 9 months, and he didn't even care about how the mother and the baby is doing and how things etc. were. And this doctor that they assigned to us this time around, like, was completely, all over the place, doesn't having any understanding of like what's going on. She seemed to say that you should go talk to your primary care physician, because this is not related with gynec or anything like that. That's what her whole thought process was. So finally, the test results came out. Meanwhile, we took another appointment with a different hospital, Swedish this time around. There, the experience was extremely welcoming. So, as you know, in US, you can't get an appointment. If you take appointment today, you'll get it for next like 3 4 weeks and things like that. Luckily for us, in Swedish hospital, we got appointment in 1 week, and I explained the narration that I'm explaining it here, that these are the things that we are undergoing, and the fever is not coming down. So we are very anxious at this point of time, so please let us know what we should be doing. So reading that, the doctor from Swedish hospital called us immediately the same day. She said, "Oh, your concerns are seeming to be very very severe. Rather than next week, why don't you guys come today itself? Let's see you in the evening itself." So same day, like when I filed our report, same day we went in the evening to meet the doctor. Doctor was very kind. She had already read all the my charts. She had already seen all the test results, etc. That's what you call a doctor. Like, because all the things are already available on the my charts, all the data like your blood pressure, your details, etc. All we need to provide you is anything new that is not already captured in the my charts, right? And that's the context we provided to the doctor. She was very caring. He did certain tests, like physically examined my wife, etc., and she was able to tell this seems like a and seems like a and by that time, the vaginal infection came positive actually, which the previous doctor was saying it's not a possibility. The fever and chills are inconsistent with that, and that's what came out actually, because we forced her to order that test. So the test came in. We asked this doctor, she also saw it. She prescribed like a yeast and a fungal prescription medication to eradicate that. And we took the medication the same day from the hospital, from the pharmacy. Meanwhile, our main doctor from Evergreen never even cared to respond even in 2 days. So we sent repeated mails to her. Do you agree with the prescription? Do you have any other suggestion? Zero, nada, nothing came out. Finally, we already basically lost hope on the Evergreen Hospital, and we decided that these guys need to be reported, because not only they are callous, they lack empathy, they lack knowledge, and they don't know like wellness management. Like, from the day the delivery happened to this date, there are so many inconsistencies, so many holes in the way Evergreen Hospital runs, and the kind of experience that they have provided, that now I can tell you for sure that if you get delivered in US, be very very focused. like be your own advocate. Ask certain questions repeatedly. Don't go by what doctor is saying. Here doctors have not studied really well. Here doctors are very very transactional. It doesn't matter if you have seen the same doctor for the last 9 months. On the d-day, that doctor may not be present there, and that doctor may not even care about whether how the mother is, how the baby is. There is no bond formed between the doctor and the patient. This is very uncharacteristic of India. Like, we had our first child in India, I have already covered in my previous podcast. The doctor was the same all throughout, from the start of the pregnancy to all the way delivery was done by the same doctor. I mean, there are other challenges in India, I'm not going to discount that, right? Doctors are greedy there. They want to like always do a c-section to make more money, and those problems are there. Here they like pushed for like do the natural delivery and things like that. But the kind of care that is provided, kind of support that is there throughout the process, and the ownership a doctor takes is completely missing here in the US. Now imagine, our own doctor who we saw for the last 9 months did not tell us the procedure that when you come in the emergency, go to the maternity ward, there will be a bell, press the bell, then somebody will basically take you in. All he told us is just go to emergency. And when we reached to the emergency ward, emergency people had no idea about like how the maternity works, or how to take care of a person who is experiencing in the last leg of labor. That's the kind of mismanagement that is there in the hospitals. Finally, when we went to the uh, you know emergency ward, the nurse sitting there on the same like Kirkland, like Evergreen Hospital, did not know the way inside the hospital. Can you imagine this? And she took us. She was roaming all around, and finally she had to ask somebody else to tell like where can I take these people to a maternity ward, and that's how it happened. Like, you can see, I'm already extremely excited while I'm talking about this, because there's just so many thoughts going on in my brain right now. Because after delivery we were so happy with the baby and all for a week or so, but the ordeal started after that. Yeah, it's already been like 1.5 months. We're not fully recovered. Thankfully we got into a different hospital, and our primary care provider is like extremely kind and very responsive, understands her own case better than the gynec, right? She's not even a specialist for gynecology or childbirth and things like that. She's giving a better treatment to my wife than the actual OB and gynec specialist doctors who we saw for 9 months in the same hospital with the plethora of tests and things like that. So we are in the situation right now, that we should be basically suing this hospital, because this is not the kind of care they should be providing to anyone. There is a lack of empathy, lack of ownership, lack of knowledge, poor quality of service. Like, I can keep narrating n number of things that are bad with the Evergreen Hospital and how they conduct themselves. On top of this, there is another interesting thing that happened. So when we got our baby, they issued us a birth certificate by the hospital, which had mother's name, father's name, and the baby's name. All three of them were correct as per our documentation that we had filled. Then they asked, you have to file with the state for getting the official like birth certificate. So we actually filed with the state to get the official birth certificate. When we went there to actually get the official birth certificate with the state, it had incorrect mother's name. Can you believe this? So we asked that, hey, you have done a mistake. This is the incorrect, mother's name. The state told us that this is the information provided by the hospital, so we can't do any changes unless the hospital provides us this. So we contacted the hospital again. Okay, you know what they said? They said, yeah, we probably missed this. We suggest you deal with it. You deal directly with the state. Like, can you believe this? Like, hospital is doing the mistake, and they're expecting us to deal directly with the state, whereas state has said, because this has been sent by the hospital, we can't do anything unless updated form is sent by the hospital again with the correct name. So finally, again there was back and forth between us. We called multiple times to the hospital. They kept on pushing it back on us that, oh, nothing can be done from our end. You need to contact the state. You should physically go to the state capital, which is probably like more than 100 miles from our place. It was a complete nightmare. So finally, again, I had to blast them on this as well. I had to say that enough of this back and forth. It is your mistake. Take ownership of it. I provided the father's name and the mother's name. Our insurance, everything has both father's name and mother's name and the child's name. Everywhere it is correct. You have screwed up. you own it and get this fixed. So finally they caved in. They said, okay, we are going to send the updated information to the state, but we cannot guarantee if they will take it or if your form will get corrected. I said, you do your part, and we'll basically figure out with the state after that. So they basically sent in the information. We contacted the state, and state said yes, they have received it and they have updated the information. I went to the state office again to get the new birth certificate, and this time actually it was the correct information. So hospital cannot get the names correct. Hospitals doctors don't care about the baby or the mother. The main doctor which we saw for the 9th month, and we thought this doctor is very kind and relating, he used to ask very good questions and whatnot, would have some basic courtesy to basically at least say that, hey, I would like to meet with the mother and the child to see how they are doing, do you have any concerns or anything like that. No, not in the 6 weeks visit, not during the pregnancy. She was there in the hospital with me for almost 3 days, right? The first day when she came in, 24 hours she was there before the delivery happened. After delivery also she was there again another 24 to 25 hours. In 2 days, doctor could have shown any time. Doesn't have to show in the night or in the day, etc. He could have shown any time. Even if he didn't show up at that time, we went for 6 weeks visit. Again, he was not there, or he could have at least called us over the phone or sent us an email. None of it. So this is the level of bond and the ownership the doctor takes, and he didn't even care to read through all the my chart, that what sufferings we are going through, what my wife has been enduring. And as a family unit, right, we have two children, both are toddlers, one is newborn. With all this like constant like chills and high fevers, etc. As it is, she is like recovering from pregnancy, right? You lose, like my wife already lost 3-4 kg weight. Actually, she was never so thin even before marriage, actually, which she is right now, which is unimaginable. Generally women put on weight after like childbirth, and not lose enough weight that they're even lower weight than what they initially was even before marriage. That's the level of weight she has lost because of this constant struggle and like fevers and infections and things like that. So I thought, I should be sharing this information for the good of a lot of people. But one thing I can tell for sure, we knew, the healthcare and wellness industry here in the US is extremely horrible, very low quality, very inaccessible, and very unaffordable. But having gone through this, outpatient treatment where the ownership is completely lost, make you keep jumping from one doctor to another to another to another, and none of these doctors are knowledgeable. In fact, I am coming to this opinion that doctors who graduate in India from AIMS or the top institutes in India are way high in intellect than the average doctors we see here in the US, who just go to any school without having to compete with the best brains, and are not knowledgeable. Neither they have any empathy, or they lack complete ownership. So here are certain things, having gone through this ordeal, I would like to suggest that the hospital systems and doctors do here. One, you have all the data on my charts or any that system that Epic I think provides the software for such kind of things. uh, Go through it in detail, like see the patient's history, see what are the things that they have done, etc. When you hand it over to a different doctor, let that doctor consult with the previous doctor so that they get the context, and then they should read through the paperwork so that they understand when they are going to see the patient. They should come all informed, not like some dummy who comes in and then asks the regular questions that are already out there. Here it seems doctor keep just doing check mark. Oh, do you have any illness? Do you have any fever? Do you have any this? Do you smoke? Do you this thing? This is not the question to ask. This is already provided in the my chart. It's already there. Like I'll not start smoking and drinking when I'm like pregnant, when I have never done that in my whole life, actually, right? uh, you should only ask these questions if something has changed. If everything is remaining the same, then the same data kind of flows in, right? So that's where you should focus on. Thirdly, the main doctor who you see throughout the 9 weeks should have the ownership. Even if they were not available at the day when the delivery was done, they should come consult with the delivery doctor and any aftermath of doctors, so that right transitions can happen, because they have the most contact, because they have been with us, they understand our contacts throughout the history. So that should be the case. Lastly, nurses here are completely untrained. They have zero knowledge of like how the process happens, etc. So better training has to be provided to the nurses. I think it basically leadership is where I think the total failure is. Have the step by step procedure to your emergency department, to the patients, to the doctors, that hey, if you come in non business hours, there is a maternity ward which has a bell outside there. You click the bell, only then the doors would open so that anyone can enter the emergency ward. My suggestion is, if you anyway have a dedicated facility to take care of maternity folks, why not have that door open, or have a dedicated person standing there all the time, so that any patient who is coming in an emergency for labor can be taken care of right away. Have a like a stretcher and like a wheelchair ready there, so that they don't have to run with you while their water is breaking and things like that. That's a minimum courtesy I think it has to be done. Moreover, when you give paperwork to be filled by the people when they're already quite tensed, when they have come for delivery, etc., it's better to validate it with the people there, that hey, have you filled this correctly? Have you filled this correctly, etc. Or if there are any questions, then have them answered there and then itself. Don't leave it for the next nurse to figure it out, because that next time never happens. Which in our case, which never happened, and they put a wrong name for the mother as totally their fault. So that's the episode that I wanted to share with you. I know this is very different from the a month back when I uploaded another podcast where I contrasted the India experience and the US experience, because India experience was uneventful, kind of, because in 6 days my wife was up and running. In US, on the other hand, it's already been more than 40 days for us after having the delivery. We are still recovering. We still don't know have we fully recovered, or we are still in the midst of the thing. So that's what has caused a lot of frustration. And we have gone to like urgent care, emergency room, doctor's clinic so many times now that I don't even remember how many times we have gone through. So this has added to extreme level of stress, frustration, and it has created a lot of difficulty for us in the last 1.5 month or so. So that is why I wanted to share this experience, that anyone who is going through this, or anyone who is expecting a baby in the US, be very careful about like being your own advocate. Don't rely completely on the doctors. Do your own research, etc. In fact, I had a friend visit us just recently, couple of weeks ago. They also had a baby 2 years back, and they experienced his wife actually suffered for 2 years. Again, she was going through a lot of mismanagement. She went to some other like overlake clinic or overlake hospital, and she also mentioned that for the 2 years post delivery, she had a horrible time. She had a lot of difficulty in recovering back, and it took us almost 2 years to basically come back to full strength. We didn't go into details about what mismanagement and etc. happened, but I can completely imagine it would have been very similar to what she experienced. I'm hoping we are out of like the woods right now, because it's already been 1.5 months, and we are no longer experiencing the chills and the fever. And thankfully, we switched our hospital to Swedish, and the doctor there seemed to be nice, and she is responding back on the emails, and we are able to catch hold of her. And we'll soon get our ultrasound also next week, and compare the results what we get from there. And hopefully there will be nothing that comes up new there, and this would be behind our back, and we can now look forward to our future with both the kids. So with that said, this is what I had to discuss today. I hope you are enjoying your time, and I love to answer any questions that you have, or if you have any stories of your own childbirth, either here in the US or India or anywhere else, or if you have any suggestions what should be the next course of action that we should be doing. So I have documented all this thing what I just narrated, and I created this podcast as well. I'm thinking of creating like a bundle and report of it, and sending it to the hospital administration to take actions on these, the way they have treated us, and how the care is being provided. And I'm also contemplating, should I be actually suing them to cause so much of hardship and so much of pain and agony to us throughout the process, when we have been prompt and trying to do the best we can. But I love to get your suggestions, like what your experiences have been, or if you know of any contacts whom we should be contacting, or how we should be handling. So I'll be up for any suggestions and recommendations that the viewers may have. Uh, So for now, I'll wrap up today. I hope you have a great day and you are enjoying your time. Please take care of your families. Families, everything. Your wife, your kids, your parents, your siblings, etc. I time and again say, and going through this ordeal, I can tell you for sure that family is everything. Like your work, your money, and all comes later on. But if the health is not there, you can't enjoy your food. You can't enjoy your wealth. Nothing is there if health is not there. So health is wealth, and hence having a good doctor, having an access to good hospital, getting the care at the right time and the right level of care with empathy is extremely important. Unfortunately, that's not been our case here in the US. So I wanted to narrate this experience for everyone. So till next time, thank you very much for patiently hearing me. I look forward to your comments. Please like, share, and subscribe, and do let me know if there are other topics that you are interested in. Till that time, take care. Have a nice day. Bye.